IBS and hemorrhoids. Over the years, we've had many patients with both IBS and hemorrhoids, and here's why that happens. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center. If you find this video helpful, please give us a thumbs up and subscribe to my channel for more educational content about digestive health. Now, it may seem like hemorrhoids and IBS are two completely unrelated things, but you might be surprised at how many people suffer from both IBS and hemorrhoids, and there's a reason why. Now, what is the difference between IBS symptoms and hemorrhoids? Well, hemorrhoids are swollen or inflamed veins that occur around the anus and can be either internal hemorrhoids or external hemorrhoids, meaning that they are either inside the rectum or just outside the rectum around the exterior of the anus. Now, people with IBS have either diarrhea, constipation, abdominal pain, gas, or bloating. And they may have only one of these, or they may have all five. And some people have, of course, alternating constipation with diarrhea. Now, can you have hemorrhoids and IBS at the same time? Well, hemorrhoids occur when there's a lot of irritation to that part of the body, right? So there are many possible causes for that irritation, and one of those causes is irritable bowel syndrome, IBS. Now, like we said, IBS often involves diarrhea or constipation, and both of those can create a lot of irritation around the anus. So, for example, people with diarrhea are often having multiple bowel movements per day. Those bowel movements may be quite acidic as well and irritating. That also means they're wiping a lot because they're having a lot of bowel movements and wiping a lot more than average, right? So all those things can irritate and inflame the tissue around the anus. Now, the same goes for really soft stools that are muddy or sticky and that require a lot of wiping. You might not think of that, of course, as diarrhea, but you're still getting a lot of irritation around that area. So these kinds of things often lead to hemorrhoids, or at the very least make that whole area very uncomfortable. Now, constipation, on the other hand, can cause damage and inflammation around the anus simply because of the straining to have a bowel movement, or just the stretching of the tissue in that area when you do have a bowel movement in order to pass that extra large stool. So all that can irritate and damage the tissue down there, which then, of course, can lead to hemorrhoids. Now, do you have hemorrhoids and IBS, or can you? Well, if your anus is very sensitive to wiping and you have bright red blood on the toilet paper, then it's likely that you have hemorrhoids. Now, you may also have an itchy anus. A lot of people do when they have hemorrhoids. And your bowel movements, of course, are a lot more likely to be uncomfortable when you have them. So now the only way to know for sure, though, is, of course, to see your doctor and get checked out and examined for hemorrhoids, and they'll be able to tell fairly quickly. And this is always wise because there are other reasons that you could see blood in your stool or on the toilet paper, or that you could have an itchy anus. So it's important to have your doctor rule out those other things. But the most common cause of that kind of irritation and that bright red blood when you wipe is usually hemorrhoids. So now, do hemorrhoids affect the large intestine? Well, hemorrhoids affect the rectum, and the rectum is part of the large intestine. So technically the answer is yes. But if you were asking this question, I suspect that it's because you're wondering if your hemorrhoids could be causing your IBS. Now, this is pretty unlikely because I've seen a lot of cases of IBS cause hemorrhoids, but it's rare to see IBS caused by hemorrhoids. However, not impossible. And so what can happen in severe cases of hemorrhoids, it may be impossible to have a normal bowel movement because sometimes this is interpreted as IBS. Now, these patients are often using something like a stool softener or doing something to help soften the stool, make that bowel movement pass more easily because of all the irritation in the hemorrhoids. So they're trying to lessen that irritation. Now, this is where things get complicated Because when you're taking those types of measures to help your hemorrhoids, right, you might be doing something that's actually causing or contributing to something that feels more like IBS. So those are the more severe cases. And usually you're a little more aware of that, but sometimes it's confusing, you haven't sorted it out yet. And that's what you need, somebody who is an expert in IBS to help you figure that out. So now, how do you treat IBS and hemorrhoids? Well, of course, in most cases, what you need to do is focus on treating the cause of the problem, which in this case is usually the IBS. Now, once patients resolve their IBS, what we've seen is that then their hemorrhoids are often able to heal because the source of that irritation is gone. Now, if your hemorrhoids are really severe, you may need to deal with both the IBS and the hemorrhoids separately. And in these cases, your hemorrhoids won't heal even when your IBS is gone because there is more damage than you can recover from on your own. You may have some really stretched out tissue, some really enlarged, inflamed hemorrhoids that aren't just going to go down or go away on their own. Now, you're probably going to know if this is the case if you don't recover within a week or two if you've solved your IBS problem. If your hemorrhoids haven't improved within that time, you probably need more help than just solving your IBS. Now, an IBS specialist, which is not to be confused with the gastroenterologist, is the kind of person who's going to be able to help you with your IBS. Now, you may also need to see a colorectal surgeon who's someone who can help you repair hemorrhoids. Now, do you have IBS and hemorrhoids or suspect that you do? If so, don't give up hope. We've seen many patients who've been able to overcome these frustrating problems.